think outside of the box. Today I came back from my CoolSculpting treatment, second and last treatment of the upper arms. And before I show you the videos of how it went, I just wanted to give you a little bit of information. I suggest you watch my CoolSculpting video part 1, which was my first treatment 2 months ago. I was 12 inches in circumference and now I'm 11, and you still lose a lot of fat all the way up to 4 months after each treatment. So I'm just halfway from my first treatment and had my second today. Because it is a small area, upper arms, I only need 2 treatments on each arm, 1 hour on each. And in comparison with the first experience, for some reason, this one was more painful. The first experience, 20 minutes left on each hour, I started feeling the pain. On this occasion, it was immediately once they put that machine and sucked my skin in. That's exactly when I started feeling the pain, and the coldness did numb it a little bit, but not as much as I would have preferred. And once they removed the machine, the massages were painful as well. And you will see in the video, I don't know if it's me, but I believe that it was even more red than in my first experience doing the CoolSculpting. Does it work? Yes, absolutely. It takes time. You have to be patient. 3 weeks after the treatment, I started noticing the difference in terms of the clothes I was wearing. The same clothing, but it felt looser around the arms. And I decided to, hey, let's measure it to see if it's just me or if something is really happening, and something was really happening. I lost 1 inch already from the total circumference of each arm. In terms of recovery after the first treatment, the right arm was perfectly fine, only sore to the touch. The left arm, however, did develop a lot of bruising, black and blue bruising, which it happens to some people. I have a very sensitive skin, so I guess I could blame it on that as well. What else before we move on to the video? I did not forget to do my right arm first this time, so I will be able to drive my wheelchair. Not like before, where I did it last and I wasn't able to drive my motorized wheelchair because I didn't have sensation on my arm. Therefore, I didn't know how to control the chair well. After the massage, the burning kicked in. This time it also lasted about 10 minutes, so it was the same amount as the first experience I had 2 months ago. However, the burning was more intense. I suggest, my mom is a registered nurse, and she made a comment because I said to her, oh my God, this is a lot more painful than my first time. And she said that it could be because there's less fat. And because there's less fat, the machine can pull in more of your skin now. And so that can make sense completely. That is why it was more painful. If you have any questions, concerns, comments, please don't hesitate on letting me know. I wanted just to let you know too that today I'm actually celebrating my 6th week after the full tummy tuck. So I am super excited. This is the last week that I have to wear my binder or girdle or torture device, if you want to call it that way. I call it that way. So hopefully I'll do a video next week after my post-op, where I am crossing my fingers that I will be told that I don't have to wear it anymore. But I'll let you know. And in that video, I can let you know, since it will be a week after today, I will let you know how is it going with the recovery of the CoolSculpting that I had today. Thank you for watching, and don't forget to always think outside of the box. Bye!
Here comes the cold. The funniest part of the day of your surgery was watching Kaylee trying to drive your wheelchair.
Really?
Oh
my God.
All right. Just lift your arm up to the side. Sorry. Gotcha. Good. Okay, how's that feel? Okay?
Perfect. But not immediately afterwards, right? Can they use EMS?
Nice. This guy off ya here. I think this should do it.
Awesome.
Yeah.
Between this and the toning. It definitely looks, I saw your picture. I went and looked at your pictures
Oh, really?
before. Yeah. It'll be interesting to see after this one.
Quick note before I leave. When the medical assistant, Miss Kelly, mentions toning in the video where you're seeing the device being removed from my left arm, she was referring to a question that I had for her in terms of maintaining the results I've had from CoolSculpting, or the results I will eventually have, because this is a continuum of progression. In terms of 4 months after the treatment, you continue losing your fat. And I've seen a lot of videos about slender tone and different target areas that you can focus using that device, which is an EMS device, electromuscular stimulus or stimulation. And she mentioned, I wanted to know if it was contraindicated to use this sort of device on the arms. And eventually I'm going to ask this question to my surgeon for my full tummy tuck, just to see if that can help me keep and maintain the results, both of the CoolSculpting on my upper arms and the tummy tuck. And as per the upper arms, she said that absolutely it is not contraindicated. I can definitely use it And in fact, it will be beneficial because not only I am burning the fat, um, or the fat that is left after the cool sculpting, but I am toning the muscles, so the arms will look even slimmer and I guess ripped or fit. So that's something that you can consider. Obviously, there is no substitute for exercise. However, in my case, as you've seen, I have limited mobility and I need to think outside of the box and I need to see what other things I can use to maintain the results. And slender tone for now is is something positive to use. I haven't bought the device. I know it's pricey, but I am looking forward to, once I recover fully up from these procedures, to purchase it and try it and see and share with you how it goes. Thank you so much for watching and for joining my family. Take care.